name is Jane McBeth. I'm here to do my head to chest health assessment, and I'm over 18 years old. I give Chamberlain the consent to this video that is being recorded to be used for grading. Chamberlain School of Nursing, for this video that is being recorded to be used for grading purpose. So I'm going to be the student performing the assessment as well as the patient. And here I go. Good afternoon. Knock, knock, knock. Good afternoon. I am Jane McBeth. I'm a student nurse at Chamberlain School of Nursing. I am here to perform a head-to-chest assessment. I'll be taking approximately 20 minutes of your time. So I'm closing the door for your privacy. Wash my hands. Do you have any allergies? No. Rating your pain from a scale of 0 to 10. 0 meaning no pain at all, and 10 meaning more pain. What is your pain level? 0. And please, can you tell me your name and date of birth? My name is Jane, and my date of birth is 02/26. Can you tell me what brought you here today? I'm here for my head to chest health assessment. And where are you right now? I'm in my room. And what month of the year are we in? We're in the month of June. So my patient is Alat Anoren ×4. She appears to be in no acute distress. She is calm and she is comfortable. She can articulate herself and her facial expression is flat. So I'm about to perform the skin and nail assessment. So I will need you to stretch out your hands for me. So I'm about to check the skin to see if there's any lesion, any injury, or, to also check the integrity of the skin. So I'm checking the left hand and also the right hand. The skin color is even and consistent throughout. There is no lesion, there is no injury, and there is no injury and the skin, and there's no incision. So I'm going to check for the temperature. I'm using the nozzle of my hand. I'm checking this. The skin is warm to touch. So what I'm going to do is I'm going to press the fingernail. First of all, I'm checking the nail bed. The nail bed is pink and slightly round. So I'm pressing the fingernail to check for capillary refill. Capillary refill is less than 2 seconds. So what I'm going to do is that I would ask you to put your fingertip together. Can you make the heart shape for me? There is no clubbing present. So I'm going to ask you to smile for me. I'm going to ask you to puff your cheek for me. I'm going to ask you to just frown for me. And the facial features is symmetrical. So I'm going to put on my gloves and I'm going to palpate your hair to check if there's any lesion or infestation. So assume I have my gloves and I'm putting my gloves right now. So I have put my gloves on. So I'm checking your head to check if there's any infestation. So the head is normal cephalic. There is no infestation or lesion present. So take my gloves and I wash my hands. So I'm going to assess your eye. So I'm looking at your eyes to see if there's any redness or discharge. There's no redness, neither is there discharge. Can you pull down your eyelids for me? The conjunctiva is pink and moist, and the sclera is white and moist. Can you look ahead for me? I just want you to look straight ahead at the wall. Sorry. I want you to look straight ahead at the wall. And when I point the pen light at your eyes, I want you to look at the pen light. So I'm coming from here, from the right. So I want you to continue looking straight ahead. I'm going to bring this right in between your eyes, and I want you to look at it. So the pupil contracts and accommodates. The pupil is equal, is round and reactive to light and accommodates. So right now I'm going to check your ear to see if there is any drainage. There's no drainage and it is clear. Please, can you hold the right side of your ear for me? And I'm going to stand behind you on your left side. And when I whisper a word to you, I want you to repeat the word that I said to you. 1, 2, AB. So I'm doing it on the other ear. 1, 2, AB. Patient passed the whisper test. So I'll need you to tilt your head backward a little bit for me and hold on to your nostril. So I'm going to assess your nostril. The nose is symmetric, no deformity or inflammation. Can you press one of your nose for me? Take a deep breath for me. Press the other nose. The nasal patency is bilateral and there is no drainage. So I want to assess your mouth and throat. So I'm assessing the mouth. Your mouth is brown, and please, can you pull down your lips is brown. Can you pull down your lips for me? See, the gum is pink and moist, and the bottom of the lips is slightly pink. Can you, I'm going to assess the tongue now. Can you say ah, ah, ah? The tongue is pink and moist. Now I'll be listening to your lung sound. Okay, I think I'm better at this one. So when I press the stethoscope on you, I want you to take a deep breath in and a deep breath out. Right upper lobe, left upper lobe, right middle lobe, left middle lobe, right lower lobe, left lower lobe. So I will need you to turn around so I can listen to your posterior chest. So I'm going to be careful not to hit on the, on the scapular. So I'm going to go on, I'll start with my left. Take a deep breath for me and out. Left upper lobe, right upper lobe, left lower lobe, right lower lobe. Oh gosh. So the lung sound is clear interiorly and posteriorly, and there is no accessory muscle usage. So I'm going to palpate your carotid. I'm going to palpate your carotid and feel your carotid pulse. So do on this side, other side. The carotid pulse is 2+ and regular. Now I'm going to listen to your heart, and I want you to just breathe normally for me. The right side second intercostal space, aortic valve. The left side intercostal space, pulmonic valve. The left side third intercostal space, Erb's point. The left side fourth intercostal space, tricuspid valve. The left side fifth intercostal space, mid-clavicular line, mitral valve. So I'm going to use the bell to listen. So right aortic, left pulmonic, Erb's point, tricuspid. So let me start that again. Right aortic, left pulmonic, Erb's point, tricuspid, mitral. So the S1 and S2 is heard in all field and they are all normal and there is no murmur sound heard. So I need you to stretch your hands and I would palpate for your radial. The radial pulse is 2+ and is regular bilateral. So I'm going to reassess your pain from a scale of 0 to 10. 0 meaning no pain and 10 meaning more pain. What is your pain level? My pain level is 0. So this has, the assessment has come to an end. The assessment has come to an end, and I want to say thank you for your time. And I put the bed to the lower position. I raised the side rail. I locked the bed wheel, and here's your call light. And thank you again for your time. Wash my hands.